Hello, I'm your Dr. Chandrasekhar. Often when you go to doctor and if they find your blood glucose level is high, they are going to tell that you have diabetes. But they will never tell you that what kind of diabetes you have, and you will be completely unaware about the types of diabetes. Do you know how many types of diabetes exist in this world? Is it 2? Is it 5? Is it 9? Is it 25? Is it 34? Or innumerable? Don't know? In this video, I am going to disclose the biggest secret about diabetes. Now, how many of you don't know about diabetes? Because those who are suffering from diabetes, they know their disease well and more than any other clinician or doctor. Hello, I'm your Dr. Chandrasekhar. Often when you go to doctor and if they find your blood glucose level is high, they are going to tell that you have diabetes. But they will never tell you that what kind of diabetes you have, and you will be completely unaware about the types of diabetes. Do you know how many types of diabetes exists in this world? Is it 2? Is it 5? Is it 9? Is it 25? Is it 34? Or innumerable? Don't know? In this video, I am going to disclose the biggest secret about diabetes. Now, how many of you don't know about diabetes? Because those who are suffering from diabetes, they know their disease well and more than any other clinician or the doctor. As per the modern science, the diabetes variety is about 9, and as per the Indian system of medicine, there are about 25 types of diabetes. You have a knowledge about that? And in total, there are 34 types of diabetes. And today, I am going to introduce a new diabetes to this world called as SSD. Do you want to know what is the meaning of SSD? Then stay for a while, watch this program completely, don't skip. If you already subscribed, thank you. And if you're not, please subscribe and support to the maximum. Today, I'm going to tell about few interesting facts and secrets. Whenever you have been diagnosed as that you have diabetes, basically we talk about increase in the blood glucose level, right? Now, what is the normal blood glucose level? And if you want to make sure you definitely have diabetes, what is the single and most comprehensive test to tell you really have diabetes? Because sometimes the blood glucose level is high but you are not diabetic. Are you surprised? I am going to prove that today. And sometimes you may have high blood glucose level but still you don't have any symptoms of diabetes. Why? How? Is it possible? Yes, it is possible. Today I am going to disclose that secrets to you. Please stay with me. As per modern science, there are 9 types of diabetes. As type 1, which is insulin dependent, where your insulin is 0, not secreted at all. For those kind of patients, we are going to give insulin replacement therapy or insulin injection for lifelong. There's one more type was type 2 diabetes, where the insulin is available, either its concentration is reduced, or even though it is in the normal concentration, but your body is not responding to that insulin. That is type 2. There's one more called as type 1.5, where the patient will have both the symptoms of type 1 and type 2. There's one more type of diabetes called as type 3, where it is commonly seen in elderly patients, maybe more than 60 to 70 years of age, who are suffering from Alzheimer's disease, which is associated with loss of memory. There's one more diabetes called as GDM, gestational diabetes mellitus. It is commonly seen in pregnant lady because when the blood glucose level is high in that lady, it is increased only to meet the demands of the child, and unfortunately some of the ladies will carry this disease for lifelong. And one more diabetes is called as LADA, latent autoimmune diabetes of young. This is commonly seen in patients or adults who are less than 25 years of age. There is three more diabetes. The last one I'm going to disclose the secret. The diabetes called as Modi diabetes. Before that, we'll speak of other two. One is called as secondary diabetes, where the blood glucose level is high because of some other condition or because of medicines, like those who are taking corticosteroids, or those who are having high stress related disorder, or those who are suffering from pheochromocytoma, or who are having some thyroid disorders. So this is called as secondary diabetes. And we have one more diabetes, that is called as neonatal diabetes or juvenile diabetes, which is going to be seen in some babies or infants less than 6 months of age, and that is order that is commonly associated with the mutation, some small change in the genetic defect. And the last one, the ninth one, as per the modern concept, is called as MODY, MODY, not the MODI, maturity onset diabetes of young, which is similar to the type 1 diabetes seen in the younger age group of the patients. So these are the 9 types of diabetes as mentioned in the modern system of medicine. And I told you that I'm going to introduce today a new diabetes to this world called as SSD, that I'm going to disclose at last. Stay tuned. As per Indian system of medicine, there are 25 types of diabetes. You have to have a look of that. I kept a small video related to that. Please have a look and how it occurs and what are the symptoms related to that. That we'll speak later. Just have a look of that video and also comparison between the modern system of medicine and the Indian system of medicine about the types of diabetes and its symptoms. Usually, whenever a physician or a doctor starts treatment, they will not tell you why they are giving you insulin and why they are giving some medicines through mouth or oral, isn't it? That is because you don't have that interest to ask, because you may be scared or you are unaware or you don't knowledge about that. And doctors also may not feel that it is my duty to tell and explain this condition to the patient. But as per my view, as a physician and a doctor, it is my duty to disclose the types and give you the knowledge. I may not give you the money, I may not give you property, but I can give you the knowledge which is bigger than this. That's why this channel is meant. So I request you to subscribe, comment, share, and keep supporting, because your support is my strength, and I'm going to bring you the biggest surprises and the smallest thing which has to be addressed for any disease to understand, because I don't want you to spend your money lots on the medicine which is going to improve the pharmaceutical companies, but I want you to spend the money to your belongings, to your family, to your property, and for other aspects of your life, because I want you to be always healthy, because health is wealth. Do you know what is the relation between the ants and diabetes? You know, the ants doesn't have tongue, but still they are attracted towards sweets. How? How is it possible? This ants has mandible and some of the structures in its body which releases a chemical called as pheromones. Sometimes ants releases this chemical substance through the legs or through the oral cavity and the mandible, even though they don't have tongue, and this will identify where are the sweets. And do you feel they're really fond of sweets? No, your assumption is wrong. They are not attracted towards the sweets, they are attracted towards calories. They are the only creature they can sense the smell, the fragrance of the sweets, and especially the calories in it. If you keep sugar, jaggery, aspartame, that is artificial sweetener, and stevia, a plant where its parts of the plant like leaves and other structures will be having the sweet taste. If we keep these four in front of the ant's nest and allow them to choose, they choose naturally occurring jaggery and sugar, which is refined one, but they will not prefer to get attracted towards the aspartame or stevia, because these two is lack of calories. On the other hand, the sugar and jaggery has calories, so they are attracted to calories. That's why they sense the calories through sweets. But when they come to know the stevia or aspartame is having sweet but no calories, so that's why they don't prefer. But what we suggest for the diabetics are, you can have sweet without calories, and which is the substance which is having sweet taste but no calories? It is aspartame, that is chemical substance, the sugar free, and stevia, but not your sugar and jaggery, because 1 gram of sugar contains 4 kilocalories of calories, whereas 1 gram of jaggery contains 3.8 kilocalories of calories, whereas aspartame sugar free and your stevia doesn't have calories at all. So I prefer for the patients who are suffering from diabetics, you prefer either aspartame or stevia, but never try to select the sugar or jaggery. And for some people, the aspartame is allergic. If you find like that, then prefer the naturally occurring stevia, which is available in the market or online you can purchase, which is available as drops. 1 or 2 drops, it gives the taste of sweet but not calories. And one more thing, do you know one thing I told you, the only one test that will confirm you have diabetes is called as HbA1c. HbA1c is the only test that will confirm that you have diabetes, and all other tests like FBS, that is fasting, PPBS, that is postprandial blood glucose level, and RBS, what is random blood glucose level, may give false results because it depends on your food factors. And two more tests are available in the hospital called as OGTT, oral glucose tolerance test, and IVGTT, that is intravenous glucose tolerance test, that is done only for the patients who is visiting to hospital. But as you have visited the clinic or directly to the laboratory, please go and ask that you want the test called as HbA1c, because that is the only test which confirms that you are diabetes. So whenever you test this HbA1c level, it should be less than 5.5 to 6, then you are not a diabetic. More than 6 to 8, you may be having sugar level around 200 to 300. It is more than 8 to 10, maybe 300 to 400, and if it is more than 10, it may be up to 500 milligram per deciliter. So this is the only test that confirms you have diabetes, because it's not affected by either your fasting or you are having food. So please keep this in mind. And I want to continue this discussion on diabetes, but I will keep this episode as part 1. And if you want to know more about diabetes and its secrets, wait for part 2. Until then, I'm going to sign off from this program. This is Dr. Chandrasekhar. Till we meet next time, take care.
Thank you.